I'm Dr. Michael Rose. I'm a plastic and reconstructive surgeon at the Institute for Advanced Reconstruction. Nerve pain typically happens after there's been some sort of an accident or injury around or directly to a nerve. It could be something that doesn't even involve a cut. It could be a sprained ankle where the nerve that goes from your ankle up to your knee gets stretched from the rapid twisting of your ankle, and that nerve can be stretched to a point where it's injured and causes you some chronic problems such as pain and weakness of your foot. So that is one example. Another example would be you had surgery, and in the course of the surgery, the surgeon goes near a nerve and then scar tissue builds up around that nerve. And then for forever after that surgery, you have some symptoms, possibly pain, possibly weakness related to the scar tissue around that nerve. And then finally, there can be accidents where maybe you were in a car accident and something sliced into your leg or your arm and damaged a nerve and left some resulting problems such as weakness or pain from the cutting of the nerve directly. So the symptoms that people come to me most often when they have a nerve injury or nerve pain is exactly that. It's usually pain. People report it as lightning bolts. Sometimes it's numbness and tingling, and it can come and go. And that can be very distressing because a person could have a couple of really good days and then they're debilitated after that. If it's foot pain, it can be hard to walk and do other things that you like to do. If it's pain in your arm, it's difficult doing things. I'm sitting in a chair right now. Some people with pain on the bottom of the forearm can't even put it down on the arm of a chair. It hurts too much. Just little examples of things that people come to me about, and we investigate these things and we try to figure out what the problem is and then go after the problem to fix it. If you have some sort of a nerve injury, it's usually very apparent, and the severity is sort of determined by how distressed you are. Or how much dysfunction you have, such as like a foot drop or weakness in your arm or leg. So what we do is we gather from you exactly what your symptoms are, and then we can further hone down based upon your history of what kind of accidents or surgeries you've had, what could be the involved nerve. And then we can get studies. There are studies such as an EMG and a nerve conduction study done by typically a neurologist, where they can kind of map out the nerve using electricity and looking at waveforms and things like that. Or we can also get special MRI tests or ultrasound tests that can look at the nerve and see where the problem might be. Those are really the way we determine what we might be able to do for you and come up with a plan. So if you're experiencing nerve pain from just about any reason, it can be post-surgical, it can be post some other kind of an accident, or just came out of nowhere, it's worth having a consultation with us at the Institute for Advanced Reconstruction, because we can usually use some of the advanced techniques for diagnosis to figure out what's going on, and then we can apply our various techniques for fixing the problem. So the good news is, in the last 10 years, there have been incredible advances in the treatment of nerve pain. And we have various techniques that range from, sometimes it's as simple as just scraping scar tissue off a nerve, or if a nerve has been cut and there's scar tissue in between, we can just cut out the scar tissue and bring the nerve back together. And by restoring that continuity, it improves the pain and restores the function. But in other cases where we can't fix it because the nerve has been too irreparably damaged, we now have techniques where we can reroute the nerves away from where they're causing the pain to areas that are quiescent or quiet, and they don't stimulate the nerve to send a pain signal up to your brain, and therefore you're relieved of the pain. Even more currently, there have been advances where we can put a little tiny catheter next to your nerve and put a little external battery pack. These are in severe cases that can't be fixed, that can send a little electrical signal to the nerve to quiet it down. Remember, nerves are electrical transport, little devices. They're almost like a wire in your house. And by putting this little tiny thread-like wire next to the nerve that can't be fixed, we can quiet it down with a mild electrical stimulus that you can't feel. It just shuts down the nerve. And that's what we can even do in some really, really severe cases. And this is really cutting edge stuff that we're doing at the Plastic Surgery Center and the Institute for Advanced Reconstruction.